Good afternoon, everyone. Welcome to Hall & Wilcox's fourth webinar on COVID-19. Thank you, everyone, for joining us. My name is Mark Inson, and I'll be your facilitator today. I'm a partner in the banking group at Hall & Wilcox. So our team at Hall & Wilcox brings together almost 90 partners and 280 odd lawyers in previously 7 and now about 800 offices then in Australia. I'd like to first acknowledge then the traditional owners of the land on which I am and which each of you are. And pay my respects to their elders, past and present. In our first 3 COVID-19 webinars, then we covered then initial questions relating to Commonwealth and state powers, employment contracts, force majeure, insurance, banking, insolvency, property tax, corporate law, and privacy. So if you want to have a look at any of these, please look on our website. Today we're going to focus on health and aged care, and I'm delighted to welcome Alison Choy Flannigan, a corporate partner, and Karl Rozenbergs, an employment partner at Hall & Wilcox. So we'll run questions at the end, once both the presentations are done. So please feel free to type in questions at the bottom of your screen in the Q&A boxes. The presentations will go for about 20 minutes, and then we'll have hopefully about 10 minutes then for questions at the end. So let's start first with Alison and talk about the immediate impact of COVID then on the health and aged care sector. Alison, over to you.
Thank you, Mark. This afternoon's session will cover the Commonwealth, state and territory supports and restrictions, particularly for the health and aged care sector. First of all, we're going to talk about some of the government support that has been provided to the sector. Initially, the government announced a comprehensive $2.4 billion health package to protect all Australians, including vulnerable groups such as the elderly, those with chronic conditions and Indigenous communities. They provided a $100 million fund for a new Medicare service for people in home isolation or quarantine, $25 million to fund home medicines, which will enable patients to have their PBS prescriptions filled online. Next slide, please. They have provided over $50 million for the National Triage phone line, which is being conducted by Health Direct Australia, $206.7 million for 100 dedicated respiratory clinics, $101.2 million to educate and train aged care workers in infection control, and $500 million in funding for the states and territories for COVID-19. Next slide, please. The most recent announcement is $1.1 billion package to boost mental health services, domestic violence support, Medicare assistance for people at home, and emergency food relief. The Australian government has also announced that it will invest $30 million for COVID-19 research, and there are 3 areas of priorities: vaccine development, antiviral development, and respiratory medicine research. They have also announced that they will provide supports for to cover the costs for private health facilities. The details for this are yet to be announced. In relation to all businesses, the government has announced a number of support measures, and these obviously also apply to the health and aged care sector, and that includes temporary increasing the statutory demand amount from $2,000 to $20,000, providing relief for directors from any personal liability while trading insolvent during this period. And there's a number of conditions to that which you must comply with, including the debt must be incurred in the ordinary course of business during the 6-month period and before an administrator or appointment or liquidator is appointed. And it's important to note with this that the director's duties continue to apply. The protection does not apply in egregious cases of dishonesty, illegal Phoenix activity and fraud. So they will still be subject to criminal prosecutions. The government has announced flexibility in relation to compliance with the Corporation Act in certain areas, and that includes providing extra time to hold your AGM, boosting cash flow for employers. We're going to be providing an update in relation to tax initiatives that the government has announced, and they're going to be putting a 6-month moratorium for the eviction of commercial tenancies. I won't go into this in too much detail, but yesterday the government announced the JobKeeper payment, and there's a number of conditions in relation to that, and we will be publishing material providing more detail in relation to that. In relation to the restrictions that apply to health and aged care providers, there's the general restrictions, and then there's one specific for the health and aged care sector. So yesterday it was announced that there would be a 2-person limit for non-essential gatherings in public and private places, whether this is outdoors or indoors, except your own household. There are special rules for weddings and for funerals. However, what are essential activities which you can still gather for include workplaces, healthcare settings, providing care or assistance to vulnerable people, or providing emergency or to provide emergency or for compassionate reasons, pharmacies, food shopping, schools and universities where you cannot study from home, public transports and financial institutions. Even if you have these gatherings, then you must make sure that you have 1.5 metres between people and at least 1 person per 4 square metres. And you must provide hand hygiene products and suitable rubbish bins, frequent cleaning and waste disposal. The government is encouraging everyone to stay at home unless they're shopping for essentials, receiving medical care, exercising or travelling to work or education. Certain people are encouraged to stay home, including those aged over 70, over 60 with pre-existing conditions, or Indigenous people. Closures include a number of businesses. I'm not going to announce them or read them out here, but they include beauty salons and places of worship. And that would include, for example, in certain hospitals where they may have areas of places of worship. So this is all fluid, it's happening, changing day to day, so it's important that you keep up to date with your government with the government websites. There are specific restrictions in relation to hospitals and aged care facilities. I'm going to talk about hospitals first. So with these orders and directions, there are specific requirements in each state and territory. They do differ a little bit, but I'm going to talk generally about what applies across the board. So now people are restricted from entering or remaining in a hospital. They're allowed to come if they're a patient, a worker or a defined visitor. And the workers include contractors, so service providers to the hospitals. The visitors that are permitted to attend include if there's a patient under 18, a parent or guardian. If there is a patient with a disability, the carer. If there's a pregnant patient, the partner or support person. If there's an emergency patient, the accompanied person. If it's an outpatient, the accompanied person. If it is a palliative care patient, the end of life support. And the visitation must be no longer than 2 hours by 1 or 2 persons together. Despite all of that, the people that are excluded, even if you're included in those categories that I just talked about, no one can attend hospitals if they've been diagnosed with COVID-19 and not yet met the criteria for discharge from isolation, arrived in Australia, and in some states they require, whether you've arrived from another state, less than 14 days before the visit. The person has a temperature higher than 37.5 degrees or symptoms of acute respiratory infection, and the person has been in contact with a confirmed case of COVID-19 less than 14 days before a visit. So all hospitals should be asking people who enter into those premises whether they meet those requirements, and if they do, then not allow them access. And that can be included in, for example, notifications on your front door. I'm going to turn now to the aged care facilities. Again, these requirements differ state by state, territory by territory, but I'm going to talk about an example, for example, the New South Wales, and it's fairly consistent across the nation, but some of the penalties do differ. So in relation to an aged care facility, only a person must not enter the aged care facility unless the person is an employee or contractor of the facility, a resident or prospective resident, or on the premises for a specified purpose, for example, providing goods or services or pharmaceutical services. People can attend if they are making a care and support visit, but that must be no more than 2 hours by no more than 2 people, and it's only 1 visit per day. You can attend for emergency management or lawful enforcement, or if there's a ministerial exception. Again, no matter what category you are, you must not attend or be allowed to attend the premises if you've arrived in Australia, and in some states they're restricting if you've come from interstate less than 14 days before the visit, had contact with a confirmed case of COVID-19 less than 14 days before the visit, has a temperature of more than 37.5 degrees or symptoms of acute respiratory infection. The person does not have an up-to-date vaccination against influenza if the vaccination is available to the person. I pause on that because the most up-to-date vaccinations for 2020, I know that there's the stocks haven't come in yet. So you have to have a common sense approach in relation to that. Or if the person is under 16 years of age, other than providing end-of-life support for the resident of the facility. So if you're a healthcare worker, you can still go to work if you're well, and you've had even if you had casual contact, so you're caring for sick people and you've been using your personal protection equipment properly. But you must monitor yourself for symptoms and self-isolate if you become unwell. If you're an aged care worker, then those rules above apply, but also from 1 May, you must have your influenza vaccination to work or visit an aged care facility. And you must not go to work if you have a fever or symptoms of respiratory illness. So all residential aged care providers must ask their staff these questions that I've been going through to make sure that they comply with the requirements. In relation to hospitals, the government has suspended all non-urgent Category 2 and Category 3 procedures at both public and private hospitals, and this became effective at 11:59 p.m. on 1 April 2020. There's the categories in the slides there, but really the ones that would go through the Category 1, needing treatment within 30 days, has the potential to deteriorate quickly to the point where the patient's situation may become an emergency or exceptional Category 2. The government has announced that it will provide arrangements in relation to supporting the private hospitals now that the elective surgery has been cancelled, and those details are yet to be announced. And we know that the various state departments have been in touch with the private hospitals in relation to reserving capacity, and those arrangements were required to be provided by 29 March 2020, but I know that they're still in progress. In relation to telehealth and pathology, it's important to notice that they've got the National Coronavirus Helpline, which is being operated by Health Direct, and they've used a lot of telehealth, which is an absolutely amazing initiative because that provides an efficient way to provide services to the population whilst keeping our healthcare workers safe. The government has announced a number of MBS items to provide services by telehealth. Some of the MBS items are listed in the slide there, and I provided the link below. The new services must be bulk billed. In relation to prescriptions, the government has allowed certain prescriptions to be done electronically rather than hard copy, so it's important to notice. In relation to therapeutic goods, the government has announced a number of exceptions to allow therapeutic goods to be accessed urgently to deal with public health emergencies. Thank you, Mark.
Thanks very much, Alison. Now we're here from Karl, who will talk about employment issues then. Karl, over to you.
Thank you, Mark. COVID-19 has had it's had different impacts on different industries. Some industries, they've had to close down, they've had to stand down their staff, make people redundant. That's not the case on the whole in the main in the health and aged care sector. When I'm talking to my clients, what I hear is that they've never been busier. it's business as usual, and the problem is just getting staff and the reliability of staff and the resourcing. That's the main issue, and many staff are concerned. They're worried about the risks to them in the workplace, and I think that one of the key things for employer is understanding the legal requirements with work health and safety obligations, but also understanding the psychology of their staff in this interesting times, as some people have coined it. So in terms of work health and safety, employers need to, as far as reasonably practical, eliminate the risks, provide a safe working environment. And what's reasonably practicable? Well, the courts consider it's really they ask three questions. What is the likelihood of harm? Well, with COVID-19, we know the risk is high. What is the degree of harm? Well, we know the statistics, and we know that the degree of harm can be, the absolute degree can be death. And what do you know about the risks? Well, we know a lot about it, and so it ticks all of the boxes. So what can we do to try and protect those people, the workers, the patients, and the visitors to our work sites? Well, I think it's very important to follow Department of Health guidelines and to follow the specific advice that's been provided. But in relation to employees, I think you direct employees to self-isolate. I know that when they come to work, they've got to answer all the exposure questions, and many employers are requiring them to sign statutory declarations in relation to whether they've travelled overseas, whether they've been in contact with someone with COVID-19 and the like, and they're asking visitors to do the same. They're also taking staff's temperature when they come into the premises, just to make sure and be on the safe side. And as Alison indicated, from 1 May, staff will be required and visitors will be required to have the influenza vaccination. That raises a number of interesting employment issues. What if staff refuse to take the vaccination? What happens then? Perhaps it's a case that they can't be gainfully employed because it's a ticket to play in terms of being able to enter the premises, and perhaps their position is redundant. That's something that employers will need to deal with. While employees are in the premises, then there's the standard precautions, including hand hygiene, cough etiquette, use of personal protective equipment, and the disposal of sharps. But I think the really important thing is the ongoing training. I think we need to make staff feel safe. They need to understand the risks so that they're coming to work and they're being more reliable. Next slide, please. One of the key issues, we need our staff to turn up, and if they think the place isn't safe, they're not going to turn up. And then the issue is, well, what can we do? Can we direct them? Now, we have to dig a little bit deeper and work out the reasoning behind the staff feeling unsafe and why they think it's a work health and safety issue. If it's the case that they're immunocompromised or they have a family member who's the same, then perhaps you could excuse them from work. It's a fine balancing act, because you want to get the staff on side, but you also need them to attend work. If there are no other particular circumstances, then I think you can direct them to attend work, and if they don't attend work, then they're on unpaid leave. I don't know if you want to take that further and ultimately say that they've abandoned their employment, but that's got to be determined on a case-by-case basis. Next slide, please. One of the issues that is coming up is, in terms of this resourcing issue, is that in Victoria at least, I know that, but in other states, the school holidays are coming up, and typically during that time people will take annual leave or long service leave. But the question has arisen, when the school holidays are over, will staff be able to access carers leave because perhaps both parents are working from home now, and they need someone to look after the kids in that situation? And are they able to rely on that aspect of carers leave, where they can show that there's been an unexpected emergency affecting someone? Now, we take the view here that is it it's an emergency, yes, but is it unexpected in circumstances where we know that people will be staying at home and they can make alternative arrangements. Now, if those arrangements fall through, then I think it might be unexpected and they can rely on carers leave and be paid while they stay at home. Other employment issues that we've seen lately, well, I think what we will see is there's a lot of stress on staff. So there's possible workplace workers' compensation claims stemming from staff that attend who other people might think are sick, and possible ramifications, bullying as a result of that, but also the pressures. Visitors want to see their loved ones, and if they're not allowed in, or there's issues with the time that they're spending in there, or they misbehave while they're in there, that could also cause a lot of problems. The other thing that we've seen is, certain aspects of the healthcare sector have seen a reduction in work. Home care, people are afraid to let people into their houses. Respite care, the risks are too great because they're looking after the elderly. So one of the ways to get around the resourcing issues is to look at redeployment of those resources into other areas where they've got skills. Ultimately, if they can't be redeployed, then you might be able to look at stand-down provisions. I've included them. The main section is Section 524 of the Fair Work Act, which provides that where you've got where someone can't be usefully employed because of a stoppage for work, which the employer can't be reasonably held responsible, then in those circumstances, they're able to stand them down. Once they're stood down, they still accrue their entitlements and they're still employed. And I think they'll be able to access the new JobKeeper subsidy that is being put forward, was put forward yesterday. So that's something to think about and be au fait with. It can't be utilised if there's just a reduction in work or there's not enough work. But that is if it's related to COVID-19, that reduction, then I think you might have an argument that you can rely on the stand-down provisions. Well, thanks, Mark. That's it from me.
Thank you very much, Karl, and thank you, Alison, for your presentations. So we might run a few questions. There've been a few questions come in since you've both been speaking, and I'll ask Alison first some questions. What do you need to do to stop visitors coming to a facility in breach of the requirements?
Well, some of the requirements are obviously law now, so if that occurs and they come in, then you have recourse. But what we are recommending is that all hospital and aged care providers have notices at their entrances, which sets out their conditions of entry. And that's similar to when you go into a supermarket store, there's notices, you'll see signs saying we reserve the right to check your bags. It'll be similar, we reserve the right to check whether you comply with COVID-19 requirements and not to allow you access if you do not, or also to have the conditions of visitation, for example. That's using what we call the Enclosed Lands Act or trespass laws, so that if they don't comply with those conditions of entry, then you have a recourse in terms of calling the police. But first of all, what we are recommending is having a communication strategy so that your facility is sending notices to family members to say what you're doing to keep their family members safe and what are the conditions that are required for entry, so that you don't have this standoff at the front door. If you're communicating with them before they even come in, that's a good thing. And then also working out ways to facilitate the visit which do comply.
Thank you. And that's a good segue to the next question, because the next question says, what are the practical ways to facilitate visits?
Well, the most obvious one is the use of technology. So all hospitals and aged care facilities should have the ability for patients or residents who have restrictions on them as to visitors to communicate with their family members and carers using technology, for example, using mobile phones or computers or iPhones. And I've seen some providers, what they're doing now, particularly what we've seen in overseas, is allowing the visitor to stand outside and the resident to be inside and to see each other through a window and talk through a phone. So there's lots of ways that you can facilitated, there's certain conditions in relation to, additional conditions which I haven't covered in my slides in relation to visitations. So visitations must not be in common areas, they must be in private rooms, etc. So if you can have visitations outside or in people's rooms, or have a particular room where a resident can go in there, there's an outdoor area for a family member to sit and they can see each other and talk through a window and talk through communication.
Okay, thank you. And maybe while we're on a roll with Alison, I'll ask you one further question. So what's the duty of care in relation to infection control?
So under the Civil Liability Act, there is a duty of care to take reasonable measures to prevent infection control. And there have been a number of cases, particularly overseas, where organisations have been found negligent if they haven't taken those reasonable steps. And those reasonable steps would be in accordance with, well, for professionals, for example, doctors and nurses, peer professional practice. And what Karl just talked about the standard precautions would be considered what's reasonable steps. Keep in mind that what is peer professional practice, the court would take into consideration publications from different colleges and APRA and the New South Wales Health Department, state departments, health departments and Commonwealth departments in relation to infection control. So it's important that you keep up to date with all of these recommendations and guidelines to ensure you comply with your duty of care.
Thank you, Alison. And Karl, I think this is for employment then. So what actions can you take if an employee comes to work and misleads you as to the employee's contact with COVID-19?
Geez, that's a very serious work health and safety issue if they're misleading you. I would have thought that goes to the heart of the contract. They're fully aware of the precautions that have been taken and the ramifications. So in those circumstances, I would have thought that that's might even amount to serious misconduct, justifying the summary dismissal of that individual. Obviously, you'd need to go through the process and notify them and make sure you're ticking all the boxes to have a defensible position should the person bring in an unfair dismissal claim. But I think you would be on solid grounds if they misled you.
Okay, thank you. Thank you. And maybe one last question, and I'm not quite sure whether this is for Alison or Karl, but it says, how do you suggest we deal with people who either object then to the vaccine or have a medical reason for not having the vaccine? Alison, would you be able to tackle that question?
Well, the vaccine has become law. It's a legal requirement.
So in that case, it would go to Karl then, and then it would be whether someone would be capable of working at that time if they either had a medical reason for not having the vaccine or objected then to having the vaccine.
I think I said it was a ticket to play. So in the aged care sector, I don't think they could be employed. Now there's issues perhaps of indirect discrimination. There's a requirement to have a vaccine, and is it reasonable? And when you think about the ramifications of people coming in and having lower immune because they've had the flu or they've got the flu, and the possibilities that might run through the facility, well, I think you'd be on strong grounds to say that it wasn't indirect discrimination and that it was a reasonable requirement.
Thank you. No, thank you, Karl. Well, that's probably about all we have time for now, and I'm sorry we couldn't get through all of the questions then that you put. As I mentioned at the beginning, then we've got a lot of material on COVID-19 on our website, so please do have a look there. If you need any further advice or any specific advice, please feel free to give Alison or Karl a ring, and if you can't find the right person or the right COVID-19 person, please call me. So we, like a lot of firms then, are working from home, and we're very much open for business, and we're very much here to help you. So thank you, everyone. Thank you very, very much for attending.